Welcome to Public Health Matters, where we talk about matters of public health. I'm Bobbie Bagley, Chief Public Health Official and Director for the City of Nashua's Division of Public Health and Community Services. Today I have with me Dr. Storace, who is one of the well-known dentists in the City of Nashua, and also the chair for our Division of Public Health and Community Services Board of Health. Dr. Storace, welcome.
Thank you, Bobbie. Glad to be here.
Glad to have you here. So there's been quite a few conversations that I've been having with many of our guests around oral health, oral hygiene, dental health. And Tony, I found out that there's actually recognition that needs to be considered for our dental professionals. So we have Mother's Day, Father's Day, doctors, nurses have recognition days, and yet they continue to care for their families and go above and beyond taking care of their patients.
Sure.
Well, dental professionals do the same thing and need to be recognized as well. And so January, in fact, next week is Medical Group Practice Week. And I thought it would be wonderful to have our chair for our Board of Health and dental professional extraordinaire here to talk with the community and talk with our public about dentistry, about your profession, about what you've loved about it, because you've done it for a number of years and you just recently retired.
Right.
So I wanted you to talk with us about that experience over this period of time, and in particular, because next month is Childhood Dental Health Month, why is it important for children in particular to have really good oral health care and for parents to know about that. So let's start out with you telling us a little bit about yourself, dental extraordinaire, Dr. Storace.
Well, I don't know about extraordinaire, but I've had a very blessed career. It was my first choice as a young person, actually at the age of 11. I knew I was going to be a dentist because I had an accident, went over my bike, broke my front teeth, and the doctor who treated me was an exceptionally great communicator, made me feel really good. Believe me, I was terrified in the fact that it was traumatic. My face was messed up. And from that moment on, I knew that's what I wanted to do. And I had parents that encouraged me and provided me the opportunity. Went to a great college, put a plug in for the University of New Hampshire, which was a conduit to get to Tufts. Another cheap plug in there too. Right. But Tufts is like all dental schools. They're great, and especially to their alumni. But that was my first choice. That was the only place those two schools were the only two that I actually applied to. Yeah. One of the great things about going to Tufts is the education is based on medical foundation. And we know that the mouth is actually the gateway, the mirror to what's going on in the body.
Right.
So what we learn there is what we apply in our offices. Most people think of dentists and think of their specialists of the mouth, and they do their thing. But we really, when we look at our patients, when they come in, we're looking at the total body. Yeah. And if we see something that just is not really where it should be, or we have questions, luckily in our community, we have a lot of great people that we can refer to. But it is our job to look and to see, whether tissues are healthy or not. And now we know there are a lot of diseases and conditions of the human body that show up in the mouth. And so a lot of times we see patients more frequently than physicians do. So we are pretty much a gatekeeper to make sure people get into the right avenue.
Yeah, so it starts with the mouth.
Very much so.
Right, and so, and it's important that you, share with us the importance of the overall health. We tend to do this thing where we separate the physical health, the mental health, and the oral health, but it's really it's one complete unit, one complete system.
This is true.
And, you're right about the fact of it starts in the mouth and it can generate all throughout the body, go through the bloodstream, right? If there's issues with, our teeth or cavities, that bacteria can go and lodge in our heart, right? And so, it starts in the mouth. And so it's very interesting that the story that you talked about as a young person and your first experience being one that you felt very comfortable with, because most people have a huge fear, Dr. Storace, of the dentist.
Right. naturally so. This is a very personal space, and not too many people want other people, especially people that don't know that well, to be in that space. There is a degree of discomfort. Either the patient is in discomfort seeing you, which heightens their emotional situation, or they understand. You know, one of the things we always try to do is try to be as gentle as possible. But if we have to give injections, again, there is something, and there's a lot of things we can do to get away from the old school. I remember when I was a young kid getting dental treatment. Back then, they were just starting to use Novocaine, and it was $1 extra if you wanted to use the Novocaine. And I remember going down to the dentist and giving the dentist $1 so we could use Novocaine.
Let's go back to those days.
Well, the rest was put on the bill, but he wanted $1 up front for that, and he was a great dentist too. But it's really important. We were talking about children, for example, Children's Dental Health Month coming up in February. We've always been, as a profession, thinking that prevention, it's easier to prevent something than to repair it afterwards.
Right.
And so prevention is so important. We've seen a lot of changes in my lifetime as a dentist. One real significant change that happened really recently was COVID. A lot of kids, we've seen the spike in decay in children, mainly because they were home. And they were too close to the refrigerator, like I was too close to the refrigerator when I retired. And you could snack a lot, and they ended up, and a lot of times the parents said, you know, we're going to keep it cool, we're not going to, you know, get out of the house too much and all that. And so when they did start coming back to dentists, we were seeing a lot of pediatric decay, which was unfortunate, but that's what it is. So trying to be gentle, trying to encourage, trying to go into the schools. And that's really what Children's Dental Health Month is about, national campaign to promote prevention. Those things pay off in a lot of different ways. One, hopefully mom and dad won't have to pay a big dental bill for cavities. And hopefully we're developing children who turn into adults who have always had excellent health, excellent dental health, and aren't afraid to go to the dentist. Because we know if they're fearful, they're only going to come in when it's an emergency. And it's like your car. When the red light goes on, it's probably too late. Type of thing.
Yeah. So. And I actually read a statistic in the American Public Health Journal about the number of days that kids miss out of school because of poor oral health and teeth and tooth pain, the cavities. And so there are ways that can be prevented earlier on. And the earlier a kid gets introduced to their dental office, the better. So what's the best age for parents to consider bringing their child into the dental office?
Well, some of the organizations now are saying to bring them in 3 months to a year after birth. Sometimes that's great. We usually have mom sit in the chair and the baby is papoose. She's just kind of gently holding them, and we're looking outside what's going on. And if we get a cry or they open their mouth, we can look inside a little bit. But the exam is really very precursor to a real exam that occurs around age 3. But what we do is we always encourage mom to bring children in when they're getting their teeth cleaned, so that they have that imprint that mom sits in the chair, mom gets out of the chair, everything is okay. And so that usually that first visit, that first official visit, they jump right into the chair, and parents are like totally shocked by it. But they're used to it. They were part of the process of doing that. And many times, if you walk through our office, because we're heavy in pediatrics. I did my externship at Rhode Island Hospital, at Samuel's Dental Clinic, in pediatrics, and so we have a lot of children there. You'll see 2 kids in the chair. You know, usually the older child who is there getting their exam and cleaning, and the younger one wants to jump in for a ride as well. And so that's how you start in that effect. For parents at home, regular brushing and watching the things that they eat. You know, they should brush definitely after meals, definitely before going to bed, and they should get their teeth flossed. Now, a lot of times children don't have the manual dexterity to floss their own teeth. So what we used to do with our kids is we would just say, hey, you know, we're going to get the dinosaurs out from between your teeth, and we'd have them lay on the bed with their head over the edge, and that helps buy back. And we can go in there and we can floss their teeth. how effective is that? It's pretty effective. Is it perfect? No, but they get used to, hey, before I go to bed, I'm going to floss my teeth and brush my teeth. And you should do it in that order.
Yeah.
Because you want to remove the particles between the teeth so the toothpaste with the fluoride can get in between and actually do its thing. Okay?
You know what, Dr. Storace? So that's the first time I've heard about the order. It actually is. So here's, as old as I am, learning about the order, because usually you're brushing first and then you're flossing.
Well, yeah, and it's kind of been brush and floss.
Right.
And you'll catch us say brush and floss,
Yeah.
but when we're teaching, it's floss and brush.
brush.
The kind of the whole idea of even showing you the kind of, where did this come from? The idea of going to the dentist twice a year was actually from a toothpaste commercial back in the old days, and they said I think it was Pepsodent was the name of it, but I might be wrong on that. And then visit your dentist twice a year.
Yeah.
It just happens that actually works really well for people to do that, but there was no scientific basis at the time.
Right, yeah. Because now you can go,
Well, if you're pregnant, we advocate 4 times a year,
Yeah.
every 3 months, because we know there's a correlation with gum disease and low weight babies being born or preemies. And so it's really important. And actually your insurance companies now are actually paying for it because
they
they know
actually
it.
are now, right?
Yes,
So you
that's
can
true.
go
That's
4
true.
times a year now to get your teeth cleaned.
And it's actually easier for the mom because especially in later stages of the pregnancy, the baby's sitting on their diaphragm,
Right.
and if we can keep them clean and make the visit shorter for them, that's actually a plus.
Yeah, so that's actually really good. So floss first and then brush. Flossing to get rid of the materials in there so
Right.
that the fluoride from the
Right.
toothpaste can actually get in between and work.
Exactly.
They're actually now doing fluoride, at least the dentist that I go to now
Yeah.
does a fluoride treatment or will ask me, do I want
Right.
a fluoride treatment in
Right.
between, because we don't have fluoride in the water here
Right.
in Nashville.
Also, I probably be careful in saying this, but those of us that are of geriatric age, we have a higher incidence. It's kind of funny because in medicine in general, you'll notice the people highest at risk are usually the infants and the seniors. And it's the same thing in dentistry. We'll see an
Right.
uptick in oral disease in seniors. And because of that, the fluorides as a senior actually help significantly. And the good thing now is most people my age remember the old trays with the goopy stuff in there. We don't do that anymore. We use a varnish, which is a lot easier for the patient, and it's actually adheres to the tooth long enough to get that chemical switching of the fluoride into the tooth to make it preventable for decay.
Yeah. So talking about decay, so we actually had one of our community health workers do a show on a new program that we're instituting out of our Division of Public Health and Community Services, which was My Smiles Buddies.
Right.
And this is a program where they meet with the parent or the guardian in the community. So it might be at their home or it might be at an organization where they're getting services provided, like Head Start.
Sure.
And they do this whole entire educational session on taking care of the mouth, and in particular they teach them about the bacteria that's in the mouth that can cause
Sure.
cavities, and how that bacteria can be transferred from an adult's mouth into the child's mouth. So can you talk a little bit about that as well? And is that something that's also talked about at the dentist office to the parents,
Right.
even when you're doing those early introductions of bring the kid in, let them take a tour of the dentist office, and then giving them those hints as well as far as like the transfer of that bacteria?
Yeah, we actually start prenatally with mom and start talking to them about preparing their mindset for what's going on and updating them on, here are the new things compared than when you were a child. In many cases, those moms were children of ours, and we know that their dental IQ is very high, but we also want to alert them of changes. So the primary thing that we worry about as parents about children is decay and the types of bacteria that do that, the type of habits and nutritional background that promotes decay, and obviously how to maybe switch that around. But we also deal with another whole group of bacteria that causes periodontal disease or pyorrhea. My parents' generation was it called. And many of my parents' generation, what happened was they lost all their teeth. One, they didn't have dental insurance, they didn't have dental access. And a lot of parents, what they would do is the kids got their teeth taken care of and they didn't. maybe part of that was fear, but part of
Right.
it was because of economics too.
Right, exactly.
So we explain that these bacteria, like most bacteria, can be transmitted. Does that mean I'm not going to kiss my child? Does that mean no? They're going to get them somewhere around the line. Will a child pick up a glass and drink out of it after mom drank out of it or dad drank out of it? Yes. If they're going through active periodontal treatment, obviously we're going to try to talk them not to do that.
Right.
But these bugs are there. They're part of their human existence. They're out there. And our job as parents is to teach the children to brush their teeth, to get rid of those, and also to have good checkups, get in to see the dentist, and again, prevention before treatment.
Right. It all starts with the mouth.
It all does start. It's the mirror for the body. We
It
know
is.
that. We know that.
Now, there are some other things, Dr. Storace, that you've been involved with. And while you were working in your practice and now even in retirement, you continue to do work in dentistry. So can you talk a little bit about that, like what you're doing with the high school kids and your SHINE program?
Well, going back, way back when I first started, I joined the New Hampshire Dental Society, and one of the committees I was on and eventually chaired was the Children's Dental Health Month. And so what we tried to do is coordinate the whole state in some kind of organized Children's Dental Health Month, which included radio talks, going to different schools, promotional ideas. One of the things that we started here in NASHAU at Broad Street School is a coloring contest, and the kids, the winners of the different grades, would get a savings bond. And the idea had to be dentally related. I had gone into the schools and talked to the grades about dentistry, and so this was their interpretation. And there were some wild pictures of what I look like on these things. But that was really the start. And I think always, which was instilled with me with my parents, was giving back to the community. And I'm a firm believer that you should give back in things that excite you and you feel you can contribute to it. I don't like people saying, hey, you got to go do this. I want you to have passion and dedication in doing it. So education is kind of in our background. Over the years, that program has grown and grown, and I'm not involved with it anymore. There's younger dentists. It's a great way for younger dentists to get into communities, meet with the PTOs, PTOs.
PTOs, they have
PTOs
both.
now,
They
yeah,
actually have both.
So I'm dating myself, but it's a good way to get involved with your community and to get that message out. Now in my sunset years, about 10 years ago, or maybe a little bit more, I can't remember, we started a program that was unique in New Hampshire. We have students from the Technology Center at NASHAU High come into the office and actually have a program where they shadow, they have a didactic or a discussion about everything from anatomy all the way through geriatric dentistry and everything in between. And the part that they love the best is the hands-on part where we go in the lab and they actually drill teeth. These students are not necessarily dental students, even though we've had a couple and I mentor them. They're now in dental school. But most of them are going into hygiene and assisting, and they'll probably never drill teeth, but they love to do it.
Yeah.
And so we have extracted teeth that they actually do that, and then they fill them. And they have a good time. And they put seals on the teeth. And there's hands-on things. They get to put goopy things in trays and take impressions of themselves and pour up the impressions. And then they get to keep them for their desk, for that. And there's a lot of other hands-on things that they get to do. The whole idea of the program is to, is this what I really want to do in life? And if it isn't, okay, that's good. We served a purpose that kept you from going to school, paying that tuition, and find out, I don't like to look at saliva, okay? So this is a good way of doing it. And we've had one person who said, thank you, but no. And others have had a great time. And the ones that go through the program, from my understanding, listening to the students, get straight A's when they're in school. And we think so highly of the program. We've hired one of very rare that we have openings in our office for staff, but we did, and we hired Amanda, who's going to be teaching with me at the high school on next Friday. And these kids will listen to her because she's their age group and she's pretty close to from when she graduated. So the program has done really well. And the kids that didn't go on still talk to me, still email me and thank me for the opportunity. that's giving back.
Right.
That's
Yeah.
good.
And
we
that's
enjoy that.
awesome.
And then also sitting on the Board of Health is
Right.
another one.
And you've been on the Board of Health for a number of years because we met when I first started working at the health department.
Way back when.
Way back when.
When I had hair and it was a different color. Yeah.
And we actually, Dr. Storace worked on an initiative in NASHAU that was looking at trying to get fluoride into
I
the
remember
water
that.
here.
I remember that.
Because that's a very important, again, preventative measure for preserving our teeth. And people have, different opinions about fluoride, and so
And you got to respect that too.
and you do, right? And so just understanding again the the importance of that, because I remember at the time I was doing home visits, through our maternal and child health program, and I would see, quite a few moms that had cavities and that had a lot of pain in their mouths, and they were, sucking the pacifier and then putting it into the child's mouth, and it was just the thought of what are some ways that we can prevent, some cavities. And at the time, fluoride is one of those ways to do that, right? Kids even still get, remember the fluoride tablets?
Oh yeah, I remember.
Right. So those were some of the things, but that's how we met.
Right.
And you were the chair of the Board of Health at that time.
Well, one of the things that's interesting, people think if you take fluoride in whatever form it is, it's going to keep you from getting cavities. Yes, if you still follow the nutrition things. I mean, if you're still eating
all the
tons
other
of
pieces,
candy,
exactly. The brushing, the flossing, right?
It'll
And the
slow the
nutrition.
process down. It'll make the tooth harder and harder for the acids from the bacteria to leach out that calcium and then invade the tooth. There's no question about that.
Right.
But I mean, if you're not, keeping the brushing up, the flossing up, and there's no magic pill to take that's going to prevent you from dental disease, at least at this point in time.
Right.
Now, at Foresight, they're looking at the possibility, in fact, they're doing testing of it, of being able to get the fluoride through a nasal spray instead of on the teeth.
How would that work, though?
I don't know the particulars of it, and it's still in the research phases.
Yeah.
But one of the other things is, you just have to have those good habits, and that's what it is. And our job as parents is to teach the children, and our jobs as dentists is to teach the parents and the children so they can pass it along.
Yeah, because that's important. It really is about all of the behaviors
That's true.
that lead to those preventive factors being in place, and then
Absolutely.
making those habits and just doing it on a regular basis. I like the idea of introducing the children early on, even if they're just coming in for a tour.
Sure.
Right? And so during medical group practice week, maybe there'll be practices, and this is next week, there'll be practices that will actually allow for tourists to come in and for people, little ones, to sit in the chairs and, have the light shine on them, again, before any other things are done, but exposing, the kids to the dental office before there's a reason for them to be there,
And
painful mouth, right?
well, as a parent, maybe you don't have a dental home yet.
Right.
But there's no reason why, if you called up your local dentist, my suggestion is, I know everybody's into the 5-star thing, but I've always found if you're my next door neighbor or you're my friend, and I ask you, where do you go for dentist, or who's your physician, who's your car mechanic, and you're very pleased with them, you're going to give them an endorsement.
Right.
And if we're like personalities, chances are we're probably going to like that person because we see the same qualities that turn us on. That would turn you on. So, ask around and see. Not all dentists want to see children, and that's okay. I'd rather have you not see children if you don't feel comfortable doing it. And maybe take a tour. Can we come in? Or what I did and helped my practice grow tremendously is we used to have the different nursery schools go through the practice. We'd have the day, that afternoon closed, or that morning, whatever it was, and they would come in and everybody got a trip on the chair and everybody got to play with stuff. We'd take impressions of their thumbs and then we'd pour them up in stone. And I remember one year I brought them over to the school afterwards, and it had said "danger human thumbs" on it, and the secretary didn't know what to do. She was like, they didn't tell her it was coming in, but the kids had their thumbs and they could take their thumbs home. And it's kind of a nice way to imprint, no pun intended, but imprint on them that great visit that they had at the dentist. But there's a bunch of different things that you can do.
And there's been some legislation and some policies that have passed now that have increased access to children with Medicaid insurance, and now even to increase that to adults, because again, it starts with the mouth, right? And so if we
Absolutely.
don't have really good dental or oral health care, we're going to see that impact on the body as a whole. So chronic diseases can
Absolutely.
result
Just
from
going to
not
say
having
that.
good oral health.
Back when I was practicing, we had suspicions of periodontal disease and coronary artery disease. And now that's gone from just a correlation to pretty much a hard fact if you read the journals. Preterm babies was another one. Some things that we can see in the mouth, change in the color of the gum tissue could be some kind of blood dyscrasia, anywhere from leukemia to other very serious issues. See a patient come in with a scalloped tongue, so if they stick their tongue out and you can see kind of the grooves on the side of the tongue, could be a sign of sleep apnea. And you need to probe a little bit more. Do you snore at night, et cetera? And we all are pretty well experienced now with patients who have sleep apnea, and they need to be taken care of. They need to be looked at by a pulmonologist. So there's a lot of different things, and not even including cancers or precancerous lesions, things like that. So it is important to have it checked out, and the best person that can do that is your dentist.
Right. Yeah. One of the things that we talked about a little bit earlier today, because of just creating awareness about oral cancer, and so the dentist is going to be the first person that's actually going to see that.
Could
right?
be.
And so we've seen an increase. And that, caused by HPV, which is human papillomavirus. And so, again, the dentist is going to be, especially for throat cancer, will be the one that will see that initially. What are some of the main points that you want our audience to take away from this conversation, this discussion that we've had today?
Well, I think the main points are the same points that I used to teach my students at Tufts. The most important thing that you as a dental provider is to be gentle with your patients, understanding of your patients, give them time, be slow. And for the patients to go, not to be afraid to sit and talk to the dentist before you even have your appointment. I've had situations where patients said, "Can I interview you?" Or "Can I sit with you and talk about me?" And not in the dental chair, because I'm fearful of that. Take the time and do it. Converting that one patient who is totally terrified is one of the best, most rewarding things that you can do. And also, brush, floss, obviously. Do the right
Floss
things.
and brush.
Floss and brush. See, even we do it. We are so tuned to saying that.
Yeah.
And then think the other thing is also to enjoy what you do. Since we're recognizing the professionals this week, enjoy what you do.
Right.
Have a passion for it every day. And in the long run, your patients will take care of you. Every day in my practice, the way I looked at it was Doctor Appreciation, Staff Appreciation Day, because the patients would get up, they would hug you. You can literally change people's lives,
Nice.
which is important.
Awesome.
Okay.
Thank you so much,
Thank
Dr.
you.
Storace, for being
Appreciate
here
it.
today as we recognize Medical Group Practice Week and honor and acknowledge that dental professionals need to be recognized as well. After all, you do take care of our teeth, and it starts in the mouth first.
Okay. Thank you. Appreciate it, Bobbie. It was fun.
All right, so I'm Bobbie Bagley, and I'm reminding you to have a great day today and a better day tomorrow. See you next time on Public Health Matters.